awarded the Best Lady Veterinarian Prize and gold medals in recognition of her academic skills. Due to Rohini's ardent desire to better the welfare of stray dogs, she worked as human education officer and veterinarian for an animal welfare charity called Compassion Unlimited Plus Action in Bangalore. We are honored to have you, ma'am. The stage is yours.
Thank you very much.
Thank you so much, Dr. Rohini, for joining us for this program and for the commemoration of the mental health today. Thank you for your so many adjustments you made on your dates. I know last week was your busiest schedule. Still, you gave us time, and when you wanted on 8th, because of the sequence, we requested you, and still you accepted. Thank you so much. Such a wonderful blend of knowledge. I've already attended one or two of your. So thank you so much for accepting. We are very fortunate somehow through Dr. Shah. I'm also grateful to Dr. Shanti. Through her only I came to meet you all through Project Maya Life. All such good arts, the project. I know how much keen you are interested in putting up your part in the project also. And I think this is the one of the contemporary therapy which is picking up and access. That is what I want to say. Your therapy is most accessible. We can very convert into very productive and accessible because if you look at the theme of this year's mental health, World Mental Health Day is access to all, access to everyone, reaching everyone. I think this is one of the best modality because having a pet, how you can positively convert that into a therapy or making no children because now it's most the family is shrink down, single unit family. No, one of the major drawback what I'm looking at when I see my patients is nobody to express their emotions. Nobody. They are also not able to identify rather they have nobody to express.
True.
So sometimes we end up saying at least you talk to a wall, but it looks odd. But you have to express yourself. At least you write it. You can't write it. You talk to a wall because you have to ultimately, push it out to get this. Push it out, at least express. I think this is the best, one of the best modality of having a pet because they have the pets have the equal emotional reciprocity. They reciprocate the emotions. They are very, very. I think they build a very good relationship. In fact, even I had a relationship with a very small phone where I used to feel they give us a feeling of importance. No, I'm an important person for him. That gives us a very good feeling.
Definitely.
Wonderful area you're working on, and we are happy for your knowledge. You're ready to share, to listen to your knowledge, so that all our student community who are going to uptake this therapy, they're all future psychologists, will benefit. Thank you so much, Dr. Rohini. We'll start the session.
Thank you very much, Professor Tainmori. It's only because of you that I'm here able to share this wonderful therapy with all your students and with all budding therapists and some doctors I heard. So it's a great opportunity and a wonderful decision during Mental Health Week. So thanks for inviting me. And I look forward to giving you all some good tips on how you can use pet therapy for yourselves and for your clients in the future. I request those who are not going to be speaking to mute your sound so that people can hear me. And towards the end, I'll take questions. You can feel free to then ask me any questions you might have. Okay? So I'm now going to start sharing my screen, if that's okay. And you can let me know if there are any issues with that, okay? Can you all see my screen?
Very much, Rohini.
Okay, all right. So we're going to start uh, from the beginning. So mental health and pet therapy. This is for Chintha 2020. So I am a holistic veterinarian. That is, I integrate human and animal welfare. I integrate conventional medicine and I integrate holistic options to give the best to both the pet and to its pet guardian. So let us start at the beginning, which will be the importance of mental health. For the past 4 or 5 days, you've all heard some fantastic webinars. And there is no doubt in our minds about how important mental health is. So, simple words, mental health is the condition of a person. It's their mental condition, which means the emotional and psychological well being is what we call as mental health. And it is important at every stage of life, whether it's a child, a teen, an adult, or an elderly geriatric person. In fact, Dr. Shanti Sairam, in her very first one, had mentioned about mental health even in an unborn child or the fetus. So it goes to show how vital it is for everyone. It literally dictates how we live, how we think, how we feel, how we act, and how we handle stress. It impacts our physical health. If you have a mental health problem, you'll be surprised how many people end up with physical health problems. And these are called psychosomatic illnesses, and you're probably aware of it. And vice versa. If you have a physical health problem, you're definitely going to have it impact your mental health. So, therapy for mental health should be a top priority for everyone and should be available to one and all. This is what I strongly believe. But it's not that easy because there is taboo, there is stigma, and people are scared to get help for mental health, which should change. And it's changing a lot in foreign countries, at least in USA and in England. People love getting help for mental health. They do not hesitate. They know that if they fix their mental health, they can perform better, live better. So, what is my advice for better mental health? This is what I think. There is no psychiatrist in the world like a puppy licking your face. Just a little puppy to hold, to cuddle, to kiss, to love, to nurture is all you need for good mental health. And I can vouch for this because I have seen this in my whole life. These are all the pets I've had through the years. The first one here is a little white calf. It's a cow, it's a little calf. I used to call it Chupramani after, Munram Pirai Sridevi. So this little calf was called Chupramani, and he brought so much joy to all of us. My grandfather had a cow in the house, and he would only drink milk from that cow. And this calf was our very first pet. And then as we grew up, we had this lovely dog called Timmy. He was, I helped deliver him, and I think that's when I started realizing that I wanted to be a veterinarian. And then I had Silky, this lovely black cat, Frodo, this black and white cat. They are all deceased now because they were all alive a while ago. And this is Troy. We lost him a couple of years ago. He was this beautiful crossbreed dog. We adopted him, and he gave us so much joy. And I can still get tears in my eyes when I think about these wonderful pets. And now the last one here is Joy. He is my current pet, and he is naughty. He can never be a therapy dog, but I'll explain to you why. But he gives me therapy. He makes me happy. He fills me with joy. So we move on to why pet therapy is important and what pets do for us. Just their eyes have the power to speak a great language. You can always look into their eyes and see love, see unconditional love. So, this is a list of things we always talk about when we talk about pet therapy and what pets can do for us. They provide companionship and comfort. They make you feel needed. For a lot of people, their families suddenly act, children grow up, they leave home, and husbands and wives, live in separate rooms, separate jobs. They don't feel needed. And this is something that pets provide. They make you feel needed. Then we have pets reduce anxiety. They just calm us down, they help us relax. They motivate us to exercise and to be playful. That's why depressed people find pets wonderful. They make you want to go out and exercise rather than just staying at home and staying in bed. A lot of people are lonely. They don't even know how to socialize. But when you go for a walk with your dog, you automatically meet people in the park and they want to talk to you. They say, "Oh, that's a wonderful dog." And it goes on. Children, especially children with ADHD, have found pets very calming. And it also helps them get rid of excessive energy. So if the children are bouncy, they want to do stuff all the time, the best thing is to have a pet. Also, pets are great listeners. Just like Professor Thane Murray was speaking in the beginning of this talk, pets listen to you unconditionally. They don't retort and say, "Oh, that's a stupid thing to say." They cannot reply to you, but they listen. And I have so many clients who have said to me, "These pets understand every word I say." They say, "Oh, the dog understands. He knows how I'm feeling today." When I was very ill a few years ago, my cat was my best companion. He would come and lie down next to me as if he knew I wasn't well. And I would talk to him and he would listen. Pets are great for shy kids. So if you have a kid who doesn't want to talk to people much, they can start by talking to pets. In England, we used to have a session where children who are shy would go to dog shelters and read stories to these animals in shelters. Autistic children, this is something I'm very passionate about. Working with autistic children and using pets to stimulate them is extremely advanced and a very positive therapy nowadays. So it has been found that stereotypical behavior can be reduced. Autistic children have sensory sensitivity. That can be reduced too by connecting them with pets. Moreover, these children then turn out to be better at working with adults and with humans. They are much more social after interacting with animals. Finally, what is wonderful about pets is they provide unconditional love. I have seen cases where pets have been abused by their owners, but the pet has never turned on them. The dog still loves the owner as much as it did before. They might have scars, but they love you unconditionally. They don't say, "Oh, you didn't feed me today, I don't love you anymore." It doesn't work like that. It's just the way they are made. They love you without judgment. And that is something which all of us can do with. Now, during these corona times, we are all stressed. But the best thing that happened, especially in USA, because I live here, is that there was a 40% increase in pet adoptions. Animal shelters are now have waiting lists. They were full and we had to euthanize animals that weren't finding homes. But now the shelters are empty because everybody has gone and got a pet. Why? They want something to engage their kids. Otherwise, the kids are at home watching computers, playing on games, phones all the time. And this is not good. So people go and get pets for entertainment, for engagement. But I think deep inside, they all know that these pets are therapeutic. I, as a veterinarian, have been mega busy because of COVID, because all these puppies have to be vaccinated, they have to be checked. So, it's wonderful, but I keep thinking, when all this is over, will they still have time for the pet? And I'm hoping that they will. And this is what I try to educate people. And remember that a pet is just not for Christmas or not just for today. It's a lifetime commitment. These pets can live anywhere from 10 to 15 years. So you have to provide that kind of commitment when you get a dog. And I always advocate for better pet care as everyone is home. So they all look at the pet and think, oh, he's not well, she's not well, let us take her to the doctor, which is wonderful. But I also think sometimes people focus too much on the pet, which I strongly advise against. Pets do alleviate stress and boredom, there's no doubt about it. But that should not be the only reason for getting a pet. You need to get a pet because you want to love, you want to nurture. Let us move on to something more formal now. There are two different things. One is pet therapy or animal assisted therapy, and another thing is animal assisted activity. As you can see here, animal assisted activities refer to activities like recreation, like horse riding. So there you see a picture of my daughter Michelle. She used to love horse riding as a child, and even now she rides. And you can see how happy she is smiling riding that horse. In fact, it was at horse riding that I was first exposed to pet therapy in England. I used to see Down syndrome children, children with special needs. They used to have special days and they used to come horse riding. And their parents used to tell me how this is the only time the child is smiling or is happy or is engaging. So, this clearly shows you that this sort of animal assisted activity can be very, very positive. So now we move on to formal animal assisted therapy, which we also call pet therapy. It is a proper therapeutic intervention. It uses animals in a properly made treatment plan. And we don't just say, this animal is good for everything. We set specific physical, social, and emotional goals with the human patient. And this is done by the doctor. The doctor is the one who prescribes this particular therapy. And it has to be you as a psychologist who can prescribe this therapy. You can say, I have identified that this person has this physical need or this social need or this emotional need for which a pet might be ideal. And you'll be surprised. Pet therapy has been going for centuries. In England, horse therapy has been known from the beginning of time, and same in China and in India. The most popular used to be hippotherapy or equine therapy. Even now in England and USA, this is one of the most popular therapies, especially for people and children with cerebral palsy and motor dysfunction. Horses have a natural affinity for children and for people with mental health problems. I and my daughter some Sundays, we go to something called Cathedral for the Horses, where there's about 15 of us, we sit in a field, we all meditate. And then they let the horses out into the field. These horses are free. There's nobody with them. They can come and go as they please, but they are in this farm, like an enclosed area. They walk around, and I've always seen they go and stand by the person who is most sad, who has some mental disorder, who is autistic. They naturally know. I don't know how. They go and nuzzle this person, and immediately you see this person who was glum smile because they feel special that this horse has chosen them. They come, they nuzzle, and automatically this person feels better. And they come every week just to sit and meditate with the energy of the horse. And that's a beautiful thing to see. Right now, the most popular therapy is dog assisted therapy. As you can see, there's a child there who has some physical problem, and they're using this dog to help him walk, and he's smiling because children don't particularly enjoy strict doctors or physicians or physical therapists, but they respond to dogs. So they say, look, the dog is walking, you walk with the dog. They do it straight away. It's so easy to get a child to cooperate when there's a dog involved. Similarly, cats and farm animals are great therapists too. Parrots have been well known in speech therapy, and dolphin therapy is very popular in places where there is in Australia, in Florida, for children with Down syndrome. They somehow create a desire in these children to, you know, uh, react to people, to behave with people. So I'm not going to go into details on all these different therapies, but I'm going to focus on dog therapy today because that is the easiest animal for you to get. So, does pet therapy works? I am a strong advocate of it, and definitely pet therapy works. Research shows when we are feeling despair, loneliness, or any chronic health issues, even depression or anything beyond our scope, or we can't cope with life, pets help to ease our pain. Just hugging and speaking to a pet who won't judge you or your feelings can help people get through rough times. Playing with dogs and cats can elevate levels of serotonin and dopamine, which can calm and relax you. Just a moment. And also, a lot of people have been asking, which pet is right for me? Are pets good for your mental health? We've all agreed that they are, but which pet? Yes, I think cats are amazing and they definitely rock. But as you can see, this is just to make you all smile. Cats can sometimes be difficult to understand. They they have they like they say cats think they own you, dogs you own. Okay, so this is just like an icebreaker, so you all understand that cats are great too, but dogs make much better pet therapists. Okay, so where do I fit in as a veterinarian? As you can see, I come in to pick the right animal for the right task. I recommend which animal should be picked for appropriate training. I make sure that the animal receives appropriate training for its role. I ensure that the health and welfare of that animal is addressed and it's not compromised. Because if you think about it, there's no point in me sending a perfectly healthy dog to somebody's house and then the dog ends up becoming more sick than the owner. I have to make sure that the mental health of the dog is also protected, which is why it's my job to check these animals and make sure they are doing okay. The other thing we need to look at is I have to work collaboratively with psychologists, with doctors, with physiotherapists, with OT, with everybody and all service provider colleagues to develop and support guidance for the appropriate use of animals for therapeutic purposes and to assist people with disabilities. Okay, so this is what the American Veterinary Medical Association expects of veterinarians like me. So, how do I go about doing this? It's not as easy as you think. It's not just get a dog. There are different types of dogs. There are service dogs, there are therapy dogs, and there are emotional support animals. So some people will just need a full service dog. And we're talking about guide dogs. So think about people who are blind or who are deaf. They need a full service dog. This dog is trained for years and years before it gets to that stage and then it's handed over. Then we have therapy dogs, and those are the dogs we are talking about. And then we have emotional support animals. These dogs are required by a psychotherapist or a psychiatrist or they will say this person needs emotional support and this dog provides that emotional support. They have to certify that. Then I certify as a doctor that this animal is fit for being an emotional support animal, and that's how it works. So which kind of dog you need is decided by me, the doctor, and the therapist who trained the dog. So there are even more categories, making it more complicated, but you don't have to worry about all this. Think about it in very simple ways. Service dog. We're talking about mainly guide dogs, dogs for the deaf, some other dogs. Then we have emotional support animals, like I just described. They can go on the plane with you because some people have anxiety while flying on the plane. So they are allowed to bring this emotional support animal. They are certified, they have to be registered. Then the plane will allow them free of charge to travel with this person on the plane. So I've seen them many a times in the USA. And then we have therapeutic visitation dogs. These are the dogs that go to old people's homes, they go to hospitals, they go to prisons to cheer up people. And they have to be certified too. And they go through special training. And then we have what we call the AAT dogs. And these work with physiotherapists because they work specifically with mobility issues. That's the dog you saw in the previous slide, which was helping people walk. And finally, we have facility therapy dogs. So they live in a rehab place or in a home, and they are there all the time to cheer people up, to help them with different therapies. You don't need to know everything about it, but I am here as a resource, and there are many people who can help you assist in deciding. So, is it easy to select a dog? No. A lot of thought goes into selecting a therapy dog. These dogs have to have a fantastic temperament. They have to basically be little angels. They have to be perfect. They have to be show no aggression. They have to be relaxed in any kind of situation. They have to be very obedient. They have to be quiet. They have to be friendly and outgoing, because we don't want a shy dog who is not going to come to you and nudge you and make you smile. But they have to be at the same time gentle and calm. They should not be startled by noise. So imagine you go to a hospital with this dog and suddenly they have an alarm going off because somebody is crashing. We don't want this dog to get stressed and freak out. These dogs are calm no matter what happens around them. They should not be noise sensitive, and so they shouldn't be startled. So if suddenly there's a crash, a patient falls down, this dog should not be startled. They have to maintain their cool at all times. And they must not be shy, as I said before. They have to be willing to come and smile and wag at people and, be social. They must never jump on people, because a lot of these children and people who need therapy are weak. They cannot, some of them are so weak they're holding like a frame or a chair. You don't want a dog that jumps on them because it could make them fall, and that's the end of story. The dog is out. So they must not chew things, because in hospitals and in places like where they need therapy, a lot of important gadgets. So if you have a dog that likes to chew wires, what's it going to do in a hospital? It'll chew up something major. So we do not want a dog that chews things. And this is interesting. They must not shed too much hair. Why is that? It's because some people have allergy to dog hair. So these therapy dogs can go to any place. So if you have a dog that sheds a lot of hair, you keep it at home or take it for a walk. But if you're going to take it to a hospital, a bus stand, you're going to take it to a prison, there might be people who are allergic to dogs. So you have to be very careful that you pick a breed that doesn't shed too much hair. Finally, it shouldn't be a dog that barks a lot. No, dogs, in fact, should not bark at all, except to warn their owner if they are therapy dogs. So you can see it's not easy to be a perfect therapy dog. How do you go about getting a therapy dog? In the USA and UK, it's a long process. But there are other easier ways to get. But I'm going to give you a quick detail about how to get a therapy dog if you're in the USA or the UK. And I think similar rules are now being followed in India too. First thing, you need to adopt a dog. And usually they say get a puppy because they're easy to train and you know the dog from day one. The best breeds are Labradors and Golden Retrievers, but there are also other breeds that might work as a really good, therapy dog. But, a veterinarian like me or a therapist will tell you if that dog is suitable. Even if you look at the checklist I gave you before for temperament, you'll have an idea. Always, always get a good professional dog trainer to train your dog. And then you have to register the dog. Here you have to register them with a good organization like the usserviceanimals.org. And then once you've trained your dog, they have an exam. And this exam is for you and the dog. The dog, you can only take this exam when your dog is a year old or older. And they have to pass the certification test. The American Kennel Club recommends that dogs also pass the canine good citizen test, and that's not an easy test to pass. There's a big list of things that the dog has to qualify before it can be selected for that. And, and once these dogs are certified, they can fly with you, they can use public transport, and they can even stay in hotel rooms with you. In USA, a very top quality certified service dog can cost up to $50,000. But not everybody needs such a $50,000 dog. You can get a dog for free from a shelter and train it to be a very good therapy dog. So don't get into panic and think, oh my God, I haven't got that kind of money. This is the best way to do it, but there's also much more less expensive ways to get a therapy dog. Let's move on to how we can apply pet therapy in real life, because this is where you as a clinical psychologist or a doctor will come into play. You can advise pet therapy dogs to calm and comfort people in hospitals, old age homes, schools, and prisons. There are studies which have shown that very hardened criminals show long-term changes in behavior after interacting with pets. Some of these prisoners have never experienced love, and this dog has given them love and affection for the first time, and this can be transforming. Juvenile delinquents, young people who are in crime, they've all been benefited by dogs and by pets. There are people who have panic attacks. A dog can easily distract them and divert their attention from the stress of a panic attack and make them feel pleasure and just relax. They stabilize the patient's emotions. People who don't talk much will talk with their dog. They help with socialization. Finally, now what is lacking, especially during Corona times, is touch. We're not allowed to hug people. We're not allowed to kiss people. We are so scared. Pets fulfill this emotional need for a human being to be touched. You can hug a cat, you can hug a dog, and you'll find that it rapidly calms and soothes you. Because when you hug somebody, you cuddle someone, it releases oxytocin, it releases serotonin. These are all calming hormones. There is a lot of research that proves that pet therapy works. It'll take me all day if I go into all the studies, but I'm just going to pick a couple of studies from each country so you get an idea that this thing works. For example, the Mental Health Foundation in England, there's a very big group called Cats Protection Group. And they did a study in 2011 with a huge variety of cat owners and non-cat owners. And some of them, at least half of them, had experienced some sort of mental health issue. 87% of the people who had a cat felt that the cat had a very positive impact on their well-being. 76% of them said that they could cope with everyday life much better because of their cat. UCLA Health, the University of California, Los Angeles Health Department, made a statement that pets help increase mental stimulation. They assist in recall of memories. They help sequence temporal events in patients with head injuries and Alzheimer's disease. So it's revolutionary therapy. The American Psychological Association in Miami made a statement saying that pet owners had greater self-esteem. They were more physically fit because pets encourage you to exercise. You have to go for a walk with your dog every day. Pet owners are less lonely. Pet owners are more conscientious and they're more extroverted. They tend to be less fearful and less preoccupied as compared to people who do not own pets. A doctor has put this statement out, which is by a dog owner. And she says, when he comes and sits up beside me every night, it's different. He needs me as much as I need him. And we feel so much love between us. The biggest problem we have with today, you all have heard, is because we tend to use people and love things. We love our phone, our cars, our homes, much more than we love people and animals. The opposite should be done. We should love people and animals and use things. And this is where the shift is going to happen in the future. These are some links I've given you. You're welcome to look at it in your own time and look at the more research that has come out in pet therapy. Children especially are the best advocates for pet therapy. They tell you how pet dogs have helped autistic people, Asperger's syndrome cases, to just calm down and stop them from these outbursts. The dog knows that this person is going to have an outburst. It just goes and sits next to them and nuzzles them, and this person laughs, calms down. They don't go into that outburst phase. In the USA, Journal of Critical Care in 2018 came out with a paper, and they said that these therapy animals should be taken into ICU because they are a great exemplar of non-pharmacological interventions that can help ICU patients become active and engaged in their recovery as early as possible. When there's a dog there asking you to give him a treat, you cannot ignore it, right? This is the key, non-pharmacological. It's very easy to pop a pill, but we all know that they have long-term side effects. And when you stop taking them, you can feel suicidal, you can feel down. But with a pet, there's nothing like that. It's a very safe, non-pharmacological intervention. At Yale University, it was reported that just even unstructured interaction with a therapy dog boosted children's positive emotions. It boosted their mental health. And they did a study where they gave one child a soft blanket to cuddle and another child a dog to cuddle or a pet to cuddle. And it was obvious that the children who interacted with the dog had reduced anxiety compared to those who didn't have the dog. So this is proof that pet therapy works and it's necessary. In England, the Royal College of Nursing has done many studies, and they always say that pets promote social interaction and reduce psychological responses to anxiety. The Scotland NHS has said that there are many benefits to animal-assisted activities and therapy. People tend to go out, so there's fresh air. They don't get stuck at home because they are depressed. They interact with different age groups because children will come and play with you, come and talk to you if you're an elderly person walking a dog, because children like dogs. You can have group activities and a different environment. You can, walk long distances. Today you can walk here, tomorrow you can walk there. So the dogs encourage you to explore because dogs like exploring. I wanted to talk to you briefly about animal-assisted therapy in India. I was very pleased to know that there's an organization called Animal Angels Foundation. It's in Mumbai. It was founded by Radhika Nair and Rohini Fernandez, and they were both MSc clinical psychology students in 2005 when they started this. They found that animal-assisted therapy is effective in children with pervasive developmental disorder because these kids can confide in these pets. They found evidence of improved eye contact, speech, and social skills. Dogs will pull or nudge your hands, so they encourage children to play. And most therapy dogs that they use work with autistic schools, old age homes, children with disabilities, and with all kinds of special needs. And the latest thing that's happening now in India, which is very positive, is that schools, educational institutions, and even corporate setups are opting for animal therapies to counter their stressful lifestyle. So there is a very good career if you want to make a career out of animal-assisted therapy. If you love dogs, you have a good clinical psychology background, then you can use animals. You can get dogs, you can train them, and you can make this a good career choice. Finally, how do we go about making a successful animal-assisted therapy program? It needs cooperation from everyone. Doctors, psychologists, veterinarians, nursing staff, trainers, volunteers, everybody has to work together to bring about the effect we want, the result we want. We have to plan ahead and set realistic goals, and everything has to be supervised properly. We have to be sure that we have selected the right dog, the right age, the right breed, everything. And by making a perfect match between the patient and the therapist. The therapist here I'm talking about is the animal. It can be a horse, it can be a dog, it can be a cat, it can be a dolphin. But we have to make sure that it's the right combination. Finally, whichever animal we choose, it has to be properly trained to be a therapist. Just like we all have to train to be a therapist, same goes for the pet. I believe, as a veterinarian, as a human, as a pet owner, that animals can definitely help humans heal. It's a newly evolving field, but it holds great promise and potential for many populations across the whole world, for children, for elderly, for disabled, for anyone with a mental health problem. The best part is it goes hand in hand with other therapies. It can augment therapies like counseling, cognitive behavioral therapy, speech therapy, OT, everything. You can go hand in hand and also have pet therapy side by side. Never forget that the human animal bond is a very powerful force. It has the capacity to bring about change. They can change your life, they can change the way you feel. And these are all very good mental health benefits. If you cannot afford a proper pet therapy dog, at least get a good companion animal. Just go to your shelter and adopt a dog or a cat. Make sure it's the right temperament for you and work with your veterinarian and with your doctor to make it a wonderful asset and a wonderful therapy for your mental health. So before I go, I would like to leave you with this slide. I have seen people for whom life has become so hard that they are suicidal. But pets give them a reason to live. An old lady who has nobody in life once said to me, I don't think I would want to live if it wasn't for my dog because he wakes me up every day. He gives me a reason to be. A wonderful psychiatrist, Viktor Frankl, he wrote this book on life's meaning. Those who have a why to live can bear almost anyhow. If we don't have a reason to live, we cease to exist. Viktor Frankl was in a Nazi concentration camp. He's a Holocaust survivor, and he's a psychotherapist. And he wrote this book and he made this statement. And I have seen it in many, many people who have lost the will to live, who don't have anyone. Pets give them a reason to live. I want you all to have good mental health. I wish you all good mental health. And I thank you all again for your patience for listening to this. Go ahead and get yourself a pet to help your mental health get better, to be cheerful. Happy mental health to all of you. Thank you.
Thank you, doctor. Even I feel like going and getting a pet, at least for my son. So,
Yes,
any
please do that.
questions? Uh, any participants who like to ask question, please unmute yourself and ask. Otherwise, you can even type in the chat. All the way other side of the world, Dr. Rohini is available for us today. And I think this is the one blessing in this corona pandemic. We identified this online classes and lectures and workshop. Wonderfully, it is working.
Yeah.
Hi, Marie. Can you hear me?
Yeah, yes, Dr. Shanti.
Yeah, that was a fantastic presentation, Dr. Rohini Satish. I'm so proud to say that she's part of our team,
Yeah.
and she's a Carnatic singer. She's a professional singer, and she's in so many TV and radio shows. It's a
Oh,
pleasure listening to you, Dr. Rohini.
Thank you so much,
I
Dr.
had,
Shanti Raj.
yeah,
I'm here because of you, so thank you.
I feel honored actually. So I do have few comments and questions for you. Yeah,
Sure, go
you gave
ahead.
us a completely different perspective on pet therapy for special children, especially, ADHD and autistic kids. I do recommend pet therapy for kids, for almost all the families, in fact. We talk about what's called the hygiene hypothesis. I wanted your comments on that. especially in younger infants,
Mm. Um, when you mean hygiene hypothesis, are you referring to the concerns that some autistic children might have with regards to hygiene?
Not only autistic kids, any kid, because I do have some families with children, when I test them, they're allergic to cat dander or dog dander. And
Yeah.
it's so sad to see them cry when I tell them, you can't have the pet anymore.
Yeah.
So
Now,
I
there
wanted your
is,
comment on the therapy, allergy therapy, as well as the hygiene hypothesis. I mean, when we introduce a pet in a family to small children, I believe the immune system gets activated sooner and it protects them in the future for against
yes,
allergy and infections.
you're totally right there. So, before people used to say, doctors, in fact, used to advise, oh, if you have allergies, don't have pets. But that has undergone a huge change in recent times. And we have proof that kids and babies, especially who grow up with cats and dogs, stop having these allergies because their immune system adapts. So, telling a child that don't get a cat because you have an allergy is not the solution. I think my husband was allergic to cats, and I had to decide, the husband or the cat, and I had to choose the cat. So, anyway, what I'm trying to say is he's still with me because he stopped being allergic to the cat over time. He just, it's the same with children. You can choose cat which has less fur. There are cats which are totally without fur. So you can start with a cat that has no fur. You can slowly acclimatize the animal. You can teach the owner how to brush the cat very often or get it groomed so it doesn't shed so much. And they do great. The only people I say, or the only children I say should not have pets, are those who have OCD about hygiene. If they are constantly washing their hands and they are afraid of anything getting dirty, these people will have a hard time even with pets, because pets lick everywhere, they lick themselves and they lick you. So these kind of people, you have to be careful. But otherwise, there is no reason why anyone should not have a pet. And the more younger the child is when you introduce the pet, the easier it is for the child to get used to the pet. So, you know, people are allergic. Some people are allergic to nuts. Some people are allergic to this. These are things that you can avoid. But pet allergy is not that major as far as I know. And a lot of people can grow out of it. But if the allergy is so severe that it's causing breathlessness, then obviously you have to go for the hairless breeds. And I can give you a list of that if you need, and we can go down that route. Hope that
Thank you
answers your
so much.
question.
Just one last question. Corona infection in pets.
Okay, so this is a topic which everybody is still very much sitting on the fence. We've had letters from the Animal Board and from the American Veterinary Association. Um, Without going into too much detail, I can tell you this much, that yes, if you have COVID and you go and kiss your cat or your dog, or you touch your dog after touching your nose, COVID can go to the animal too. But I have yet to see a case where I've actually tested a dog or cat and found it to be COVID positive. In fact, the tests are in such demand that we don't have enough tests to test humans. So, where are the tests to test the animal? So, if you think about it that way, but can animals give you COVID? I don't think so. We usually give COVID to the pet, but they are usually asymptomatic. I'm yet to see a pet who has actual COVID symptoms. We hear of the tiger in New York Zoo, we hear of a pet here or there. But this is what I say, if you have a pet and you have COVID, just like you are not supposed to go and socialize with people, don't let your pet socialize with people. Don't let your cat jump out of the house and go to another home. Keep your cat at home. So it's because cat at home, because we treat them as fomites. So it's like, if you touch your phone and you have COVID, if somebody else touches that phone, they could get COVID. It's exactly the same with the dog and the cat. So as far as research goes, we now consider them as fomites, exactly like an object. So don't share them if you have COVID. That's all I would say right now.
Thank you so much, Dr. Rohini. I'm like on my way to work.
Thank you. It was a pleasure listening to you.
Thank you, Dr. Shanti.
I'll see you tomorrow for the
Sure.
webinar.
Thank you.
You too, Tain Marie. Yeah, thank you.
Take care.
Thank you.
Any other questions from anyone?
A wonderful question Dr. Shanti answered, asked, and you answered so beautifully. So we can see how much you are a pet or what do you call petarian. Really. Any questions, ma? Others, the participants, students?
Ma'am, we have two questions in the chat box, ma'am.
Yeah, the chat box. Okay. Can you read, Dr. Rohini?
Yeah. So let us see. The first, let's go and look at the question. Uh, uh, so this is about, I'm trying to see which is the latest question that they have. So it'd be good if somebody read it out to me. Okay. Dr. Rohini, how prevalent is this therapy in India? Any place where we can get acquainted with this therapy? One of the slides answered that. There's the Animal Angels Foundation in Mumbai. In fact, two MSc psychology students started this center, and it's in Mumbai. You can go through my slides and you'll find the name of this foundation. You can Google them. They have a Facebook page, and they are doing very good therapy. In fact, it's a good career choice for MSc psychology students, because pet therapy is just amazing. So, you know, if you like dogs and you know people, there's a huge vacuum in that area in India. Not many people available to do pet therapy. So it's an instant win-win if you decide to go into it. And people have pets, and we call it pet therapy. But it's not the same as formal pet therapy, which is what I was trying to give you an idea about how it's done in UK, USA. But, you know, there's always a place to start. And the people in Mumbai, I did some research on them, seem to be doing a good job. And I think a few other organizations are coming up. Definitely Chennai, doesn't seem to be much going on. It's a good field to start. So you can, there's a lot of, they even do courses. This group in Mumbai, Animal Angels Foundation, and you can take a course and maybe train with them, and then you can start your own in another city. So there's another question. So hope that answers your question, Priyamvada. Then we have Amit Bali, and his question is, to keep dog, is it not affordable for all in India? It's expensive therapy. Okay. You can, it's like this. You can have a very expensive dog, or you can have a very basic dog. So you can get therapy even from feeding your street dog. Every street has dogs. You know, you can just go to a shelter and you can adopt a dog for free. You don't have to think that I'm going to get this expensive dog breed and spend, like, I don't know how much money to buy a dog. You go to a shelter where dogs are being killed every day because they have no space for them. Go and tell them you need a dog for this reason. They will do a match. They'll see how many people are in your family, who likes dogs. They will come and check your house and make sure the dog will be happy in your house, and you can get a dog for free. And after that, some of these places even provide low-cost health care to help you maintain this dog. And food is not so expensive. Pet food has become very, very less expensive. And I cook for my dog, so I don't buy expensive dog food. I just, you know, when I say I cook, I mean my husband cooks for the dog, okay? So not me. So he's a very good cook, and he loves the dog so much. I remember coming home and I thought he was making some great korma for me. He says, no, that's the dog food. You have to make some food for yourself. So he cooks for the dog. It's very easy. Rice, some potatoes, different vegetables. If you're a non-vegetarian, take chicken, cook all of this together. That's your dog food for the day. Just keep it in the fridge and feed the dog 2-3 times a day, or you can make a large amount in your Instapot cooker. It is not so easy. It's not at all expensive. Um, it's like this. You can have a very expensive car. I want a Lexus, or you can have a very basic car. It's exactly the same with the dog. And I'll tell you this much, a dog is worth it. Instead of wasting money on branded clothes, I would any day spend it on my dog. He gets all the best treats in the world. He's spoiled rotten. And that's because once they teach you to love again, you know, and that is the biggest reward. So you have to ask, what is more important, your bank balance or your mental health?
Thank you, ma'am.
If your answer is mental health, I would strongly advise a pet.
Thank you, ma'am.
You're welcome. Then I have Krishna Priya. Ma'am, how do we overcome loss of pet animals after getting attached to them for years? Yes. This is actually a question for a psychologist or a psychiatrist, but I'm a pet bereavement counselor. So I have people whom I have, guided over the years when they have lost a pet. It's heartbreaking. How do you get over losing a human? It's the same sort of thing you do losing a pet. And yes, you're much more likely to lose a pet than a human simply because animals don't live as long as me and you. Or we are going to experience the loss of a pet. There are different ways, and when I do counseling, it is tailor made to you, what sort of a person you are you religious, does it help you to know that the soul never dies? Do you believe in the Gita? Do you believe in the Quran? So we go through some religious beliefs, then we tell you that everybody has to die, nobody lives forever. So instead of the pet died because its job in life is over, it has to follow its karma, its path, and you have to heal, and you will heal. You will get depressed. The easiest way a lot of people find this very useful is they immediately go and get another puppy. Some of the Western people, especially in the West, people are very, very clever. So, and they know that they're going to be very depressed when this dog goes. So when they know that this dog or this pet is getting old or sick, they will go and get a puppy. So this other dog also lives longer because puppy cheers them up. These people fall in love with the new dog and they can cope much better when the other dog goes. But that may not work for everybody. I'm just giving you examples. So it has to be a personalized approach. So that would be my answer. It's not easy. It's hard. And people say, never again. But every person who has said never again has gone and got another dog. And I see them within few months with a new puppy, happy and cheerful. In my own experience, like we lost our dog, Troy, in June 20th, 2018. We were devastated. We had him from he was 6 weeks old. I was depressed. My husband was very, very depressed. I would hear him walking around the house talking to Troy because he's so used to talking to Troy. He would say things like, oh, where are you, stuff like that. And I decided at that time that, this man needs help. He is seriously upset. So we convinced him, and we went and found another dog. He was in a shelter. We got him home. One look at this joy, and my husband was like, I want this dog. And they are inseparable, right? So there you go. So that's your answer. It's not easy. Yes, Troy will always be in our hearts and we will always feel bad, but we have joy to cheer us up, and that helps. So there's a whole counseling session we do for grief counseling, and we can talk about it another time, and you're all aware of it because you have to know how to counsel grief in people. So it's very similar to that. Hope that answers your question. And there's, what about birds? Do they have any influence? Yes, birds are fine too. Any pet is good for your mental health, unless the pet has got problems, in which case, if the pet is sick all the time, or, it's a sick animal, or it's got issues themselves, then it can cause you more stress. But otherwise, parrots are great. They live the longest. That's the biggest advantage of birds. Many of them, like parrots and African greys, are very popular because people have had them for generations. The mother gives it to the daughter, to the granddaughter. So I have lots of clients who have birds too. In fact, birds can even talk, they learn, they sing. They can imitate, like they're wonderful pets. So yes, go ahead, you can have pets too. The only thing I have a problem with birds is you have caged them. And I think birds need freedom. But if you can keep them in a house and allow the bird to fly around a little bit and have a nice enough enclosure, it's okay. Caged birds I worry about their mental health rather than yours. Okay. So, do you think pet therapy will work? What does it say? What was the question? And fish and losing it. Yeah, some people have talked about how they lost their pet fish after getting attached 2 years. I think the same topic. It's about grief counseling, and it doesn't matter which pet it is. Grief is real, and I understand that. It's like saying, I'm not going to have children because what if something happens to my child, right? You cannot live in the belief that there's nothing in life is certain. So it's a risk we take when we get a pet. But yes, when we lose them, we grieve. But as long as they are with us, they give us so much love. And that's what you have to focus on. You focus on their life, not their death. Um, okay, and there's a good question here. Do you think pet therapy will work for people who are scared of dogs and cats? Yes, and I'll tell you why. My sister in law is petrified of dogs. When she was young, she was bitten by a dog, and she never allowed her family to get a dog. But during the COVID, my nephew and niece absolutely love dogs. Every time they go to, they live in Texas, but every time they went to India, they would, all the stray dogs in the street would be their dog. And they kept begging their mother for a pet. My brother loves dogs too, because we've always grown up with pets. And this summer, I convinced them, the whole family convinced her, and we finally got them a beautiful Labrador from a shelter. She loves it. Her fear has gone completely. She says, in Tamil, she says, இது ஒன்று தான் நான் சொன்ன பேச்ச கேட்கறது. இது ஒன்று தான் இந்த வீட்டில் நான் சொன்ன பேச்ச கேட்கறது. Which means the dogs know. They know how to make you fall in love with them. That's why I say the therapist is not you or me, it's the pet. They know who's scared of them. They will go talk to you, and now she absolutely loves the dog. She cooks for the dog. She looks for him. I have a neighbor here. She was the same. She's scared of my dog, but they went and got her a puppy. Oh my God. She takes care of the puppy better than everybody else in the house. So people who are scared of animals end up losing their fear. So pet therapy also helps you lose fear of pets. So I would say go for it. Yes, initially they'll be scared, and we teach you how to slowly introduce the pet to them, but leave it to the pet. They will figure it out, and they will make you love them. That's what I would say.
But
Um,
you missed Dr. Shanti Shairam's question. I'll read it for you.
please.
Is there any evidence that the incidence of mental health disorders is less in families that have pets?
Dr. Shanti Sairam, that's a fantastic question, and I'm glad you pointed out Professor Tain Mori. Yes, studies have shown that kids who grow up with pets from childhood tend to have less mental health problems as they grow up. So I always say that if there is a genetic history of mental health, getting a pet is a good idea because it will stop that from manifesting. So I can try and get some papers if you want proper studies, and send it to you by email. But definitely there is evidence that families who have pets tend to be less mentally ill. In general, they're a lot more happier because animals and children 100% match. Even the most antisocial children respond to pets. So when the children are happy, the parents are happy, the whole family is happy. There's very little mental health involved. And I see a lot of people who have depression, they have treatments, but those who have pets tend to have less depression. Especially they tend to be more fit, and if you are fit, you are not depressed, you are outgoing, you are thinking. I'll tell you something which is very, very important. If you stop thinking about yourself all the time and focus on loving another person, you automatically feel better. The people who have mental health issues are people who are obsessed with themselves and are constantly thinking, why am I like this? Why am I poor? Why am I not better than so and so? Why am I not as clever as so and so? Pets turn that focus from you to them. When I'm worried about my dog and thinking about what I should feed the dog, I am less thinking about myself. So they turn you inside out, make you focus. They are a good distraction. And you can shout at them, you can say anything, and they give you love. So unconditional love is the biggest therapy for any mental health problem. And it's hard to get that from a person because we all have egos, we have issues. Animals don't have ego. They have zero ego. They love you for who they are. They are not going to say, like, my dog is now in this room, he's behind the screen and making noises because he's like, you're supposed to take me for a walk. But yes, he will sulk for some time, but as soon as I get up, he'll be so happy. He say, oh, come on, let's go for a walk. Nobody will welcome you with that much happiness than a dog. And he will act as if I've just come back from a long vacation and I've just literally gone out to throw some trash and come back in, and he'll give you such a greeting. My husband has never been so excited to see me, nor my daughter. They're all like, oh, she's back. Oh, we haven't cleaned this, something like that. But a dog is not like that. They give you such a big welcome. They give you so much love. Automatically, I feel better in myself. I feel needed. I feel valued. And just a dog or a cat can do that. It's like a little miracle when you get them. And, I strongly think that uh, this is going to be the future, which is why more and more families have pets now. In England, every 1 in 2 families have pets. In USA, it's kind of similar. And I find a lot of my veterinary friends tell me most of them have pets. The only people who don't like pets are grandmas, patis, tatas. They say, arukma, and, things like that. But you just have to convince them. And slowly, they come around. They understand that. Uh, because I remember somebody used to say to me, okay, get a cow. At least it gives you milk. Why are you getting a dog? What use is the dog? Seri, maybe it'll look after the house or guard. Don't always think about how to use this animal. Think about what you can give. And when you focus on the giving, you get 100 times more. And that's what I believe. So I hope that answers your question, Dr. Shanti. Definitely there is evidence.
She has another question to Dr. Rohini.
Can I see it?
I'm sure pets have mental health issues too. Do we as humans help them at all?
Yes, that's where my job is. So I'm a doctor for pets with mental health. So you are the doctor for the human with the mental health issue. My job is to help the pets with the mental health, because owners who have mental health can sometimes make the dog mental. It's true. I have seen it many times. And then I have told that person, you don't need to see me. The dog will get better if you get better. So you need to see a shrink. Go to a shrink, have therapy, and get better. And the dog's mental health will clear on its own. Because there's a problem with dogs and cats too. They love you so much that they can feel your energy so much, they get depressed when you get depressed. They will do everything they can to cheer you up. But some people don't want to get better. And it doesn't matter how much you can work with them. You can give them every therapy in the world, but they don't. It's like this. You can treat someone who knows they have a problem and wants to get better, but you can't treat people who don't want to get better. They like being ill. So those kind of people will make their dog sick and their pet sick. I will tell you this interesting case I had a couple of weeks ago. There was a cat which had completely lost all its fur. And I had ruled out everything like skin infection, everything. And then finally, there's a classic condition called stress over grooming in a cat. So if a cat is stressed, it will lick, 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 and pull out all its fur. So I diagnosed this cat and I said, this cat has severe stress over grooming. And I suspect that the stress is from somebody in this family. And I said, why does this cat spend most of its time? It spends its time with this girl. And she and the cat would stay in this room most of the time. And because the cat was her therapy cat when her father passed away. So I'm also an animal communicator. So sometimes I get insights. So it might seem crazy to say this, but the cat told me that the problem was with the girl and she was self-harming. She was suicidal. I was shocked because I thought, who on earth told me this? But it was like a message in my head. So I asked this person, I'm sorry, this might sound crazy to you, but somebody in this room is self-harming. And the girl burst into tears. The mother burst into tears and said, yes, my daughter self-harms. She has attempted suicide a few times. And the cat sees her cutting and he pulls his fur. He's imitating her. So I gave them both therapy. I told her to get counseling and she stopped self-harming. Then she realized that her health was affecting the health of this lovely cat. She immediately stopped. All this time she would do it to get attention, but when she realized that her health was affecting the cat's health, it gave her a motivation to stop hurting herself. And when I hear back now, they're both doing great. The cat's fur has grown back. She has stopped self-harming. It's a win-win situation. So 100%. I worry about the pets who are therapists too. Like we as therapists can fall sick too because we see people all day who are sick and it can bring us down. So we need therapy for ourselves. So just like that, cats and dogs who are with people who already have mental health conditions can have issues, and that's where that you have to take them to a veterinarian. And we have therapies for pets with mental health problems. I won't go into too much detail because that's my job as a doctor, but that question is perfect. And yes, the answer is yes, and we have treatments for those pets, and the treatment is very simple. You get better, your pet gets better. It's mutual. Any other questions?
Fantastic. No questions. I don't see any questions anymore. Very wonderful session, very lively. I think as a person, you're a more lively person. You are sending your energy through web to here. I could feel it, Dr. Rohini. Wonderful. Thank you so much.
Thank you.
Uh,
Yeah, I'm a passionate believer in animals, and I strongly advocate for them. I love them, and I think they make our world a better place. They are angels sent by God to heal us, and I think we should all benefit from them. And this is why I was so happy that I had this opportunity to speak during Mental Health Week at this webinar. So I have to go to work now because I have an 8-hour shift.
yeah.
But
Thank you very much. In fact,
um,
I used to tell my students when we organize such programs, it is not only the content shared by the presenter is important, their thinking style, the presentation style, how they carry themselves, how they talk, it's all a lesson. I think you gave a very different perspective on the presentation style and your energy. Thank you so much, Doctor. Thank you for your time. I think we'll conclude the session with so much thanks. This is going on YouTube live, and we will be sending you the link also. You can share it with your friends. Thank you so much.
thank you very much, everyone, and good mental health to everybody. Bye.
Bye. Bye, Dr. Shanti.
Bye, Dr. Shanti.
Bye bye. It was a wonderful session. To be honest, I have a confession to make. I'm absolutely petrified of anything that moves around me. I
Yeah.
cannot go near a dog or a cat, but I know these things exist, and I know pet therapy exists. It's fascinating, but it's fascinating. But I don't think I can make myself ever go near a cat or a dog. I don't think I will ever do it.
We
But
will work with you. We will work with you.
I will
I
give you a
sincerely hope.
I'll give you a personal therapy session if you want.
That's the
I'll come.
question. Do I want it? The question is, do I need it?
Thing is, I have another statement. Don't fix what's not broken. If you're totally fine and you have no mental health
Exactly.
issues and you're cool, don't worry.
Yeah, true. That's why I'm saying, do I need it is the first question.
Yes, so don't.
Also, yeah.
So if you don't want it, don't need it. But if you feel it, it means you need it. So, that's how I say. So there's no force. There's no force. So never fix what's not broken.
I know whom all to call when I think I need help.
Sure. There you are. So you have a great support system. You don't need a pet. That's okay. But for those of you who are even slightly interested, go for it.
Thank you. It was a fantastic talk, Dr. Rohini. Very
Okay.
nice.
Bye,
Very
everyone.
interesting. Bye.
Take care. Bye.
Bye. Bye.